Our next speaker is Dr. James Doty. Dr. Doty is professor of neurosurgery here at Stanford. I think I've known you for about 25 years now. And not only is he an excellent neurosurgeon, but he's had for decades a strong interest in understanding compassion and altruism. So he's formed a center called C-Care here at Stanford, which is a Center for Compassion and Altruism Research and Education. And I've heard him speak before. He's an excellent speaker. He's going to talk to us today about the power of compassion and meditation. So Jim, welcome.
Hello, hello. How is everyone? So what I'm going to talk about today in some ways has nothing to do with acoustic neuromas, and in other ways has everything to do with acoustic neuromas. How many of you actually have had or have an acoustic neuroma? And how many of you have been treated? How many of you are awaiting treatment or deciding? And how many are family members? So whether it's an acoustic neuroma, whether it's another type of condition, the very nature of being in the medical system creates anxiety, not only for the patient, their loved ones, because anxiety is caused oftentimes by uncertainty. And when you have anxiety, uncertainty, fear, it results actually, believe it or not, in a significant effect on your physiology. So beyond the medical condition you have, when you are suffering, if you will, it has a profound effect on your physiology. And all of us are suffering in different ways. It's the nature of just simply being a human being, but it's how you react to that suffering, frankly, that changes everything. First of all, let me tell you a little bit about the center. But before I do that, I want to sort of give you a definition of compassion. Compassion, when we study it, is the recognition of another's suffering with a motivational desire to intervene in that suffering. But fundamentally, it comes to connecting with others, because as a species, we thrive when we connect, when we care. And so when you respond empathically to another, when you give kindness, when you're helpful, it actually is basically our default mode of how we should be. Unfortunately, oftentimes modern society, with telephones, with distractions, put us in this mode where we're not really focused on that. And oftentimes we become anxious, we become stressed, etc. What happens when you either don't feel that you're being treated compassionately, or when you're not compassionate? Believe it or not, if we survey Americans, 25% of individuals will say that when they are in pain, when they are suffering, they have no one to connect with. No one. And in fact, if you look at the statistics, there's actually an epidemic of loneliness throughout the world, but certainly in the most developed societies, it's absolutely true. Because unlike other societies, and you might say less evolved, the reality is in those societies, and oftentimes in third world countries, where you live with those who you're related to, in multi-generational families, where you live with the same people your entire life, what happens? They accept you for who you are. And oftentimes in modern society, we have a fear of actually being honest about our feelings, about who we are, because we feel we're going to be judged. And it creates stress and anxiety. And what's interesting, in these areas of the world, if you will, are less primitive, even third world countries, these are often the areas where people frequently live greater than 100 years. And that is because their levels of stress are very low. They are in an environment where they're not judged, and whether they do something good or bad, they're accepted and they're loved. So people wonder, why is a neurosurgeon studying compassion? Because if you watch TV, and oftentimes you'll see this brusque, arrogant, egomaniacal portrayal of a neurosurgeon. Is that how you guys have seen in popular? There may be even some in this room. No, I'm just kidding. So the way I got involved in this is because of my own suffering, actually. And I grew up in a very difficult circumstance. A father who was an alcoholic, a mother who had had a stroke, was paralyzed, chronically depressed, attempted suicide multiple times. Neither had gone to college. And when a child grows up in this type of an environment, you have an immense amount of fear, stress, shame, anxiety. How do you overcome that? And frankly, there's something now that has been studied rather extensively called ACEs, Adverse Childhood Experiences. And they're actually checks on certain events that happen in a child's life, and that is associated with increased frequency of disease, actually inability to thrive. It's associated with dropping out of school and a whole variety of other ills, things such as mental illness, poverty, alcoholism, etc. But what happened to me that changed the trajectory of my life, and what I'm going to talk to you about that can actually improve or potentially even change the trajectory of your own life, is what I learned at the age of 12, which made me look at the world a different way and gave me a set of tools that allowed me to thrive as a human being and to succeed. What we, subsequent to that, and I won't go through all the details, but what I learned allowed me to become a neurosurgeon, be here at Stanford, become a successful entrepreneur, and ultimately to found this center about 11 years ago. The interesting thing is that when I began this exploration, because I was very interested in what motivates people to be kind, to be compassionate, is what ultimately allowed me to start examining this from a neuroscience perspective. And when I first started this inquiry, and in conversation with colleagues in neuroscience and in psychology, basically I was told that the study of this area was an academic dead end and no one would be interested. And what has happened over the last decade, actually, is that through my efforts and the effort of other individuals who have an interest in this, the entire world has changed. How many of you heard of mindfulness or meditation? Everyone almost, right? That's a buzzword. What is happening over the last decade is, while there has been this around for that period of time, people recognize, though, that the key component of these practices fundamentally have to do with compassion. And if you look on the right there, you will see a book that was recently published by Oxford University, one of the most prestigious academic presses, on this emerging field of compassion science. And I had the honor of being the senior editor of this with some of my colleagues. On the left is a book which I wrote called Into the Magic Shop, a neurosurgeon's quest to discover the mysteries of the brain and the secrets of the heart. And to be honest with you, I had no desire necessarily to write a book, but I would give lectures about this topic and include in those lectures my own experience, my own pain and suffering. Because when I can stand up here as an individual who nominally is successful and tell you that I have suffered, I have been in pain, people can connect with that then because you're authentic. You're not hiding anything. You're not trying to be what oftentimes we're forced to be, to sit there and say, oh, everything's okay, nothing's bothering me at all. Interestingly enough, this book, which I was asked to write by multiple people and refused for a number of years, after I got into it, it ended up being a New York Times bestseller. It's now actually in 36 languages, and it's a worldwide bestseller. And it's interesting also because I thought my own personal journey would not necessarily be able to be translated into other cultures or languages, but I was wrong. It's a bestseller in the United Arab Emirates, in Korea, in Poland, believe it or not. And how many of you know anything about K-pop? Have any of you heard of a band called BTS? So BTS, for those who know it, is probably one of the most popular boy bands and one of the most popular bands in the world. Is that correct? And the interesting thing about these individuals, which is 7 young guys who sometimes it's hard to tell because they wear makeup and lipstick, where they're at, but the important thing of where they're at is they care. And every one of their albums has to do with connection, has to do with decreasing fear, has to do with loving yourself. And so every album they've done has been based on a book. So their third album actually was based on Into the Magic Shop. And in fact, in that album is a song called Magic Shop. So you can see here, you just look at Time Magazine, you see all of this stuff. Mindfulness is everywhere. And why is that? And what is mindfulness, or what is meditation? And here are some definitions. And but what we know is that, as I alluded to earlier, that when you're in pain, when you're suffering, when you're anxious, when you feel the world doesn't care about you, it has a huge, huge negative effect on your physiology. And in fact, being anxious, being stressed, results in a decrease in your immune system function. It results in actually a negative effect on cardiac function. It results in the release of stress hormones that on the long term have a very deleterious effect on your health. How many of you have heard of telomeres? When you're stressed and you're anxious, it actually shortens your telomeres. So it's associated, chronic stress is associated with a decrease in longevity. The reason people are so interested in these practices, which date back thousands of years, is because it allows you to shift from this stress mode to one of what we call your rest and digest system. So the vagus nerve actually begins in the brainstem and has a two-way path, in and out. It receives information. It's represented in every organ of the body, and when you are stressed and anxious, it affects the other organs in your body. But the good news is, and the why meditation practices and mindfulness practices, and I will talk to you soon about a compassion practice, is because they can have a profound, profound effect on your physiology in a very positive way. One of the things that I found for myself as a child when I learned these techniques was that I was incredibly stressed. And in fact, children who grow up in these ACE environments are traumatized, and oftentimes as they grow up, they have post-traumatic stress disorder. How many of you have felt stress? How many of you have felt overwhelming stress? How many of you are stressed right now? And it's something we live with. And what happens when you're stressed or anxious is that it shifts you to your flight, fight, or fear response, right? But it does other things. To make discerning judgment, you actually have to have all of your faculties available. When you're anxious or stressed, this area of your brain called your executive control function is impaired. And this is what the area of your brain that allows you to make thoughtful decisions based on experience, based on memories, based on data. When you're in the flight or fight mode, or when your sympathetic system is engaged, you make reactive decisions because you don't have access to your executive control areas. And oftentimes when we're fearful or scared, then basically you're in survival mode and you'll make decisions that oftentimes are not the best decisions. And so if you're able to shift this stress, this anxiety, this fear, it can have a profound effect because you shift from engagement of your sympathetic nervous system to your parasympathetic nervous system, which many call your rest and digest system. On the savannah in Africa, if you believe in evolution, when we were there, when you would see a blade of grass move or some other indicator of an animal or a threat, then you would have an immediate response. This is what our sympathetic nervous system evolved to over millions of years. You'd have an immediate response. It would result in your eyes dilating, your heart rate increasing, a shift of blood from your gastrointestinal tract to your skeletal muscles, and you would run away. It would shut down other areas. And again, this is this reactive mode, this flight, fight, or freeze mode. But when you are calm, again, everything shifts back to the normal way it should be. Our lives actually should be the latter, where you're calm, you're discerning, you're thoughtful, but the nature of modern society, just living in modern society, for many people creates a baseline level of stress, which is not healthy. And then when you have medical conditions, acoustic neuromas, other significant illnesses, these oftentimes dramatically increase that. And of course, for your loved ones who are going through this, watching this, of course, they are anxious, scared themselves. So how do you deal with this? And that's where these techniques, which I'm going to share with you, come into play. Now, the interesting thing is that I've been talking about the effects on individuals, but here are some examples of what happens actually when doctors care more. The nature of providing care for people in the United States and elsewhere for physicians can actually be demoralizing oftentimes. You have a lot of demands made on your time. We have now an electronic medical record that actually consumes more time than actually taking care of patients. Doctors are distracted, pay has gone down, and there's a lot of pressure to put large volumes of patients through. But what we know, look at some of the things here, if you can. We know, as an example, that if a physician cares, if he actively shows that he's engaged and present, it markedly affects a patient's physiology. Leaning forward, showing you're interested, showing you're not rushed, touching another individual. These are all actions. Now, of course, they should be natural. They should not be forced. But when you give that to a patient, it calms them, it makes them feel safe. Because that's what we all want. We all want psychological safety. Actually, there are studies that show, for many of us, we see patients who have come to the emergency rooms repeatedly with chronic illnesses, often in poverty. and many of them are not connected to anything. There have been studies that have shown that when there is simply a person who reaches out to them, demonstrates care and concern, that it decreases the readmissions or representation to the emergency room by 1/3 to 50%, simply by doing that. Studies even show that in terms of wound healing, length of stay, chronicity of disease, severity of disease, by interacting with a physician or a healthcare provider who demonstrates that they're actually concerned, again, has a profound, profound effect on healing. Because as soon as you're anxious and scared, as I said earlier, it has a negative effect on your immune system. It has a negative effect on a whole variety of physiologic measures. So this is why it's important that not only do you give yourself compassion and to others, but physicians also. The problem, though, oftentimes with giving compassion is that individuals frequently are not compassionate to themselves. Some people are their worst critics and beat themselves up more than they would anyone they know. And this is through this negative self-talk. Has anyone experienced that here? Right. And it's interesting, right? Because why should you beat yourself up? Yet, many of us have this ongoing narrative that says we're not good enough, we're not smart enough, we don't deserve it. In fact, there are people, I'm sure, here who have a hard time if somebody compliments them. Anybody like that? Right? But why? Why would you not feel that you're worthy of being complimented for what you do or who you are? And this is the problem. So as a child, this woman I met, or I mentioned this intervention, if you will, or person I met a woman in a magic shop. That's the name, Into the Magic Shop. Okay? And I was a scared 12-year-old. And this woman I met, and I just walked in there by happenstance. She knew nothing about magic. She was actually there. She was the owner's mother. But have you ever met anyone who has a radiant smile, who embraces you, and they don't judge you at all? They're just looking at you and smiling, and you can sense that you're safe and it's okay to tell them almost anything. Those are unusual people. After talking to this woman for about 20 minutes, and she asked me some penetrating questions, she said, I'm here for 6 weeks. If you come in every day for the next 6 weeks, I'll teach you something that could change your life. Amazing, right? How one person can have an effect on an individual. What's amazing is each and every one of you have that ability, right? Everyone has that ability. Exactly. I'm very blessed. But what I was saying is, so the first thing this woman taught me was this relaxation technique, which is part of meditation, breathing, centering, because you cannot connect with another unless you can be present, unless you can attend. That's what's necessary to learn. I didn't realize that the stress that I had was causing my muscles to be really tight. I was always waiting because my life had been one of uncertainty. You never know what's going to happen next. So she taught me this relaxation technique. And the next thing she taught me was I was just talking about with you, this idea of this internal dialogue. I thought that dialogue was me. I thought that was a reflection. So when I said I wasn't good enough, it was truth. When I wasn't smart enough, it was truth. But what she taught me was that is a false narrative. As a species, as we evolve, things that are negative have a tendency to stick to us because that's typically what's associated with saving your life or limb. And as a side aspect of that, negative things have a tendency to stick to you and you repeat them. And when you're more and more scared, oftentimes you repeat this negative dialogue. But every time you do that, what you're doing is you're putting a brick down and you're building a wall around yourself. If you say you can't do something, if you say it's not possible, If you say, I'm not good enough, it's another one of those bricks. And what happens is you start creating a prison for yourself that becomes small, that becomes dark, that becomes scary. And it's a false narrative, because by doing that, you give your own power away to a false narrative, to others. And in fact, when I say others, I'm sure some of you in this room have had situations where somebody you loved, somebody you cared about, you shared your dream, your aspiration, and they looked at you and said, that'll never happen, you'll never be able to do that. Has that ever happened to anyone? Right? But when you're able to understand that this narrative is false, it allows you to unleash this immense power that each and every one of you have. And that power includes your ability to change your physiology. Not only to change the world around you, but to fundamentally change in a positive way how your body works. And this is an idea of balance or lack of balance. And I'll talk about some of these techniques in a second. But what you can do through these types of practices, through breathing, through relaxation, through attention, you can change everything. But the key is having this balance. So I mentioned to you that these techniques have been developed over thousands and thousands of years. And there are some subtleties to each of these practices. But fundamentally, these practices put you in this state where you're more reflective, where you're more thoughtful, you're not distracted by that negative dialogue. Because what happens when you say this negative dialogue is that it affects your physiology. Every aspect of your physiology. And in fact, we know that with as little as a 15-minute practice, a meditation or mindfulness practice, that you can take the production of inflammatory proteins and bring them almost down to zero. And inflammatory proteins are what are associated with the occurrence of disease, the severity of disease, and also a negative effect on wound healing. So very, very profound. And here's a slide that will show you some of the effects that a compassion meditation or a mindfulness meditation can have on your physiology. And these are documented scientific articles that show these positive effects. What I have done with my colleagues at Stanford in our center over a number of years, we developed a meditation compassion practice. Oftentimes, mindfulness is about attention and not listening to this internal dialogue. But the other aspect is having compassion for yourself and knowing that you deserve to be cared for, that you deserve to be loved. And when you're in that mode, then you can look out on the world and recognize that everyone is suffering in some way, and that they also deserve to be listened to and loved and cared for. In fact, what happens in so many instances when somebody comes on to you in a negative way, oftentimes what's our usual response to them? Like, how many of you have been driving and somebody cut you off? What's your usual response besides 2 words? But, and so you're mad at these people, right? You think they did something to you on purpose. But what if I change the narrative where you put yourself in their position, and I said, well, this person's taking his wife to the hospital. She's pregnant, she's due, she's bleeding. What happens? You've shifted your perspective, and now you care, right? And oftentimes, an action that someone does, which you think is about you or negative towards you, oftentimes has nothing to do with you. So, in summary, whether it's an acoustic neuroma, another disease, or just living in this modern world, there are practices which have the power to change your mental health, to change your physical health, to increase your longevity, and it's simply by caring. So, thank you very much.
The preceding program is copyrighted by the Board of Trustees of the Leland Stanford Junior University. Please visit us at med.stanford.edu.